Thanks a lot. I'm in a sense, all the projects are very different. So there's no sense in which this is a kind of representative project. But anyway, I got asked to be the representative project, so here we go. It's called Industrial Productivity, Health Sector Performance and Policy Synergies for Inclusive Growth, which is a rather long-winded title. But it does express very much what we're trying to do. And it's a project which is a collaboration between 3 institutions, my own, which is the Open University in the UK, and 2 African institutions called RAPOA, which has become a Policy Research for Development title, and ACT, which is the African Centre for Technology Strategies. It's, as Derek said, it's a first call project, and it's an innovation project at its core. And its aim was to look at the scope for improved productivity and innovation to, in the industrial sectors, supplying the health sector, and the extent to which there were potential benefits for the health sector, as well as obviously in terms of employment and productivity in the industrial sector, from a better link between the two, from a better use by the local industrial sector of the health sector as a market, and better supplies into the health sector, so to speak, from the health sector side. So there's a very, very specific hypothesis, which of course may well be wrong. This is a piece of research where we know that this may be wrong. But what we think is that there are unexploited synergies between improved industrial supply of not only pharmaceuticals, but we're also looking at equipment, laboratory, reagents, other essential medical supplies, and even basics like bed sheets and brooms. And we're particularly interested actually in infection control. And on the one hand, and the improvement of health services quality and inclusiveness on the other. So we're trying to look at the extent to which you could do better in terms of a synergy between the 2 areas, both of production and policy. And therefore, whether there's scope for effective policy intervention in the 2 countries in question. So it's a 2-country study, and it's very much a local study, and it's using mixed methods. We've got some quite strong process aims, if I can call them those. And the first one was to try and get collaborative capacity building in industrial economics and innovation systems and industrial policy analysis in the 2 countries, to involve private sector CEOs, industrialists, managers, health policy makers in the industrial sphere in policy debate with health sector managers. And we already knew that these were 2 very, very separate worlds that operate with very separate assumptions, networks, social networks, policy networks. We knew that there were issues in terms of the interconnection between these 2 worlds. And we were interested in seeing whether there was, if our hypothesis is right, whether there was scope for promoting more integrated and effective policy making. And then obviously we were interested in drawing from the empirical research, analytical and policy relevant conclusions for the above mentioned international publications, which we all want to do. I want to say just a couple of words about I'm just go back a couple of slides, about the institutions. This was really a project that was very much driven by the interests of those 2 institutions, RAPOA and ACT, both of which I and many other people in the Open University, some of them here today, have worked with over quite a long period of time. I mean, in the sense of decades in some cases. So it's a long collaborative process, and I'll say a little bit more about that in a minute. No? Why can't I go forward? Can you?
Let me help you.
Yeah. Thank you. Thank you. So I'm on methods. Basically, the way the project works is that there are 3 stages. There have been initial stakeholder consultations in each country. And at the moment, what we're doing is working in the health sector, and we're tracing trends in commodity supply into the health sector, both public, private, and faith-based organisations. And the next stage, which we haven't got to yet, is in the industrial side, working on interviewing industrial suppliers. And what we're doing, and I'll say a tiny bit more about this in a second, is we're building in policy debate and feedback at each stage. issue of collaborative and mutual capacity building is very important to us. Basically what we have is a project which drew on the interests of African colleagues from the start, and it was based in both countries on findings of earlier work by East African colleagues. We've got one African Research Institute whose specialism includes health, but not innovation particularly, and one that is a specialist organisation looking at technology and innovation, but hasn't actually worked much in health. One of our aims is definitely mutual learning and exchange, and that includes mutual learning and exchange, obviously, with the UK. And our view, I think, of capacity building is that there's a lot of learning from our side that's already gone on in terms of what East African colleagues, who are excellent researchers in their own right, think matters and have been working on for a number of years. And we've tried to grow this project onto a number of pieces of work that have already been done by African colleagues that we're working with. The other thing to say is that we involved local policy and management stakeholders really right from the design stage of the project. We talked to the industrial associations, to the health policy policymakers and so on right from the start. And we've run the whole thing with a 3-person management team, me, a Tanzanian and a Kenyan, with local high-level advisory groups right from the start. I was asked to say a fair bit about capacity building and impact, so this is it. And I guess what we're trying to do is we're trying to think about ways of generating policy impact, which is a key objective, though of course it depends on our findings. And local impact considerations was really where we started in terms of the original design. We had support from both health and industrial associations and policymakers right from the start, based on potential mutual benefit. But I think it has to be said that the industrial side is highly enthusiastic, and the health side isn't sure. And that's because the debates are really quite different, and the potential mutual benefits work really quite differently in the two sides. So we've done a lot of thinking about the way policymaking works, and in particular the way international policy influences and interacts with local policy, in on the one hand the industrial, on the other in the health field. And industrial policy in some sense is quite straightforward. You know, that the generation of a better industrial base is a straightforward notion of benefit. On the health side, there's been, of course, far more emphasis from the donor side on buying large amounts of medicines from India and importing them in vertical chains into a defined supply chains. This doesn't sit terribly well with work around local supplies, although many people think local supplies are important. So there's a set of very, the mutual benefit stuff is quite complicated, and we've worked quite hard in terms of, right from the start, trying to bring policymakers together. And my final slide, which relates to really what I was asked to do, is this is the way we thought at the very beginning of the project. We designed this pretty early on, and this is my Kenyan colleague wrote this initially. And this was really, we worked from this from quite early on in the project, and it's our, as you can see, our Pathways to Impact summary. And what we did was we worked out who our target audiences and relations were right from the start, and made ourselves lists of what we thought they were interested in, why we thought this might or might not be an interesting project in relation to them, how impacts might work through. And one of the interesting things about that is it generated some very interesting early discussions about whether we were right about what people might be interested in. And we discovered in some cases in the health sector we weren't necessarily right. And working from that back into what were our original intellectual ideas and then back again turned out to be quite a interesting process. And so that's my final slide. And my final point, I think, is to go back to the capacity building issue, which is, I think that there are strengths and weaknesses of this project. Like all projects, I think one of its strengths is that it grew out of real, very important local concerns and a set of locally driven past research. On the one hand, on commercialization in the health sector in Tanzania, and on the other hand, in innovation in Kenya. And concerns that both of those issues were major policy concerns within the countries, and trying to bring those together. And I think that's been productive, although the country collaboration is something that I think is building up only slowly. Thanks a lot.
Well, thank you very much, Maureen.